Over the last 25 years, we've made some great strides in the treatment of pulmonary arterial hypertension. Yet, prognosis of PAH remains poor. 70% of patients are diagnosed at intermediate risk. A majority of patients are not where they need to be. Time is of the essence for assessment and response. So, start with the heart. Changes in leading indicators like right ventricular function occur before others. Waiting for lagging indicators to change like functional class and 6-minute walk distance can take valuable time. The 2022 guidelines have placed greater emphasis on measures of right heart function and recommend right heart assessments at 3 and 6-month follow-up. Using the 4 risk strata helps you better define the clinical needs of your patients in the intermediate risk category. Yet, patients still fall into one of the intermediate risk groups at follow-up. That's why timely identification of patients who aren't at goal or declining can have a significant impact on disease progression. Patients with PAH may have a prostacyclin deficiency in their lungs, which is essential for lung function. As a prostacyclin mimetic, treprostinil acts on multiple receptors. Orenitram is the only oral prostacyclin mimetic that has 3 pharmacologic actions. For when intermediate risk patients need more, bridge the gap with Orenitram. Consider Orenitram for intermediate risk patients who are stagnant or declining, or who are inappropriate for or refuse pump therapy. Orenitram provides clinical intervention for when patients need improvement of key measures of risk. With established clinical efficacy, Orenitram improves leading indicators like pulmonary vascular resistance and cardiac output, and lagging indicators of disease progression like functional class and 6-minute walk distance. Whether they're starting de novo, titrating rapidly, or transitioning from parenteral therapy, patients can achieve the clinical improvement they need. For de novo patients, the titration kit offers a simplified start, providing a clear titration plan to follow, steadily increasing their dose every week to reach necessary exposure. Eligible patients who are clinically and hemodynamically stable on Remodulin may be able to transition to Orenitram. A majority of patients in the study successfully transitioned with similar exposure. Assess risk and consider time to identify intermediate risk patients who need more, and bridge the gap with Orenitram. To learn more, visit orenitramhcp.com.
Orenitram, treprostinil, extended release tablets. Indication: Orenitram is a prostacyclin mimetic indicated for treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to delay disease progression and to improve exercise capacity. The studies that established effectiveness included predominantly patients with WHO functional class 2 through 3 symptoms and etiologies of idiopathic or heritable PAH, 66%, or PAH associated with connective tissue disease, 26%. Important safety information for Orenitram. Contraindications: avoid use of Orenitram in patients with severe hepatic impairment, child Pew Class C, due to increases in systemic exposure. Warnings and precautions: abrupt discontinuation or sudden large reductions in dosage of Orenitram may result in worsening of PAH symptoms. The Orenitram tablet shell does not dissolve. In patients with diverticulosis, Orenitram tablets can lodge in a diverticulum. Adverse reactions: in the 12-week placebo-controlled monotherapy study and an event-driven placebo-controlled combination therapy study, adverse reactions that occurred at rates at least 5% higher on Orenitram than on placebo included headache, diarrhea, nausea, vomiting, flushing, pain in jaw, pain in extremity, hypokalemia, abdominal discomfort, and upper abdominal pain. Drug interactions: co-administration of Orenitram and the CYP2C8 enzyme inhibitor gemfibrozil increases exposure to treprostinil. Therefore, Orenitram dosage reduction may be necessary in these patients. Specific populations. Animal reproductive studies with Orenitram have shown an adverse effect on the fetus. There are no adequate and well-controlled studies with Orenitram in pregnant women. It is not known whether treprostinil is excreted in human milk, or if it affects the breastfed infant or milk production. Safety and effectiveness of Orenitram in pediatric patients have not been established. Use of Orenitram in patients aged 65 years and over demonstrated slightly higher absolute and relative adverse event rates compared to younger patients. Caution should be used when selecting a dose for geriatric patients. There is a marked increase in the systemic exposure to treprostinil in hepatically impaired patients. Please see full prescribing information and patient information at www.orenitram.com or call 1-877-UNITHER, 1-877-864-8437.